I want to just emphasise that this is an independent commission, so it's being set up by the County Council, but I am not, and my colleagues are not going to be part of it. We will be providing the Secretariat to it, but it is an independent commission. It comprises 5 commissioners and a lot of expert witnesses, and I know that Tom is really looking forward to engaging with the Essex community in many, many different ways over the life of the Commission. So I think without that I'll hand over to Tom and we'll hear more about the work of the Commission itself.
Peter, thank you very much indeed. Again, thank you all for being here. It's normally a great mistake to meet me because I have a horrible habit of enlisting people to help me. Although I work very hard, I enjoy it more when other people work even harder. And you, like an idiot, have already agreed to join in, and you told me you would too, so we're halfway there already, which is fantastic. I've learnt about new charities that I haven't heard of before, or support groups, including Why Not, and how lovely that there are so many people from Why Not here. Fantastic. Look forward to it. I'm an East Anglian. I was born in Norfolk. My father worked for the Queen. He was a young farm manager at Sandringham when I was born. So on my passport I'm rather proud, because you really have to fill out where you're born. I actually normally put Norfolk, and then the person says, no, you've got to put the town in, so I put Sandringham, and it always raises an eye. And I'm a resident of Suffolk. Sorry about that. Can't have that. But we'll have to forgive me for that. Second thing to say to you is we've got the most fantastic group of commissioners. We're all meeting for the first time. I met one of our commissioners who's here today a few weeks ago now. And there's only one of us, John Spence. I wonder if you two know John. He is himself blind and chairs the Community Foundation here in Essex. He used to be on the board of Lloyd's Bank and is one of nature's gents. And like me, just says it how it is, when neither are very good at gentle words. We just state the blooming obvious and we don't really care who it affects. So John is the missing member, if you like. My new friend, Mike Adams, Chairman of Health Watch Essex. Health Watch you'll learn more about over the coming months. But I actually believe is the one really good thing about the most recent NHS reforms. I think Health Watch will be the key to the evolution of the NHS going forward. So I was absolutely desperate that Mike should be a commissioner. Please, other commissioners, don't take this the wrong way. But I thought if we didn't have Mike on this commission, we started with a serious deficiency. And it's also fantastic for me that we have the Essex Coalition of Disabled People represented through Mike, because I'll come back to why we're here in a moment. And then the good Professor Sheila Salmon, who's chairman of Mid-Essex Hospital Services. And I have something that I love a lot, which I've told you, which is I love nurses. I ran an organisation of 5,000 people for 12 years, 92% of whom were nurses, namely Marie Curie. And I learned how nurses, in my view, understand community care as well as anyone. They do better, but I mean as well as anyone. And it's nurses who often fight so hard to stop patients going into the hospital that they don't necessarily want to go into, when at all possible they'd rather be cared for at home. My own background, of course, it was end-of-life care. We know the vast majority of people want to die at home, but sadly the vast majority of people actually die in hospital. And then Dr. Gary Sweeney, as you get to know Gary during the course of the next months, you'll discover that he has an eclectic collection of outfits. I'll keep you too heavily briefed. Last time we met, it was the most gorgeous sort of green, velvety, moleskin, what was the word? Waistcoat. And today, because we're in a library, Gary is wearing a tie with library books on it. So there you are. And if we were in Afghanistan, I'm sure he'd be wearing camouflage. And I've promised my fellow commissioners that what we are going to do over the next 9 months, probably, is have a huge amount of fun. We're going to work very hard, and we're not going to waste any time or any money. And the reason for that is that I think the problem that Peter has given me, or a very bold title of Who Will Care, and I think that's the pronunciation, if I can put it that way. It's Who Will Care. It's not that nobody cares. It is this terribly worrying fact that we, particularly all of us, face, which is, I'm afraid, I love historical facts. You might like to know that in 1870, the average life expectancy of a labourer in London was 23 years. You did well to get to 23. And as a member of what was then called the professional classes, your life expectancy as a man was 45 years. And now we've got this desperate problem, which is kind of good for us guys who are in the second half of our lives, which is, on the one hand, we're likely to live long. But putting it bluntly again, from my experience in end-of-life care, most of us in this room will die with at least 3 terminal conditions. Whereas 20 years ago, we'd only die of 1. But most people who die of cancer now, for instance, 1 in 3 also have dementia. And it's highly likely that they may also have a coronary problem or breathlessness as well. So we're all dying older, and we need much more care towards the end of our lives. So our frail period of our life is more complicated. It's getting more complicated all the time. And of course, it's getting more expensive. And of course, there are more of us. I'm reading a book at the moment, which I recommend to you, by a man called Jared Diamond, who's an anthropologist. And in some of the tribes that he's researched, one thing he's discovered in the very primitive tribes that still exist in the Amazonian forest is they don't have mother-in-laws because they're quite small tribes. They have aunts. And they bury their aunts at the end of their lives while they're still alive, because this is the sort of civilized, easy way to deal with what is otherwise an intractable problem. This will not be the first recommendation of the rule, unless you, the people of Essex, suggest it.
So it's still a possibility.
It's still on the cards. We're open to taking evidence on anything. Yeah. So I think the real problem that we're facing is probably the most difficult problem that mankind's faced in the last 100 years, or womankind. Not enough money, too many demands, and a statutory system that will not be capable of providing all those needs, either in terms of manpower or woman power, or in terms of money. It is there is about to be an explosion in end-of-life care. This is not something that's widely realised, but basically in the 1950s, our parents and others got very active in the bedroom department. And death is a function of birth. It's not actually a function of disease. And we're now reaching the stage. For 40 years, the number of deaths annually has declined every year. It's about to explode. And this is the last year of decline, this year. And from here on, every year, the number of deaths will increase. By 2030, the NHS will have to build another 90,000 hospital beds to simply accommodate the increase in the job of this commission is to focus on people who are frail, demented, disabled, elderly, and think about how can we provide the care for these people. It's an independent commission. I didn't even have to insist that it should be. Peter said to me he wanted it to be independent. It will be a very forthright commission, and it will be a very practical commission. My own track record in this area, immodestly, is quite good. So the last commission I did, which I'm extremely proud, we increased the number of people in Lincolnshire who died at home from 19% to 42%. And it didn't cost Lincolnshire 1 penny to achieve that. We simply asked the people of Lincolnshire, how do you want to support yourself and your families when you're dying?
what are the obstacles in the road? What is preventing people being cared for at home? And what we found, unsurprisingly, was that the health services and the social care services, first of all, never talk to each other. Secondly, the default position was to dial 999 and admit someone to hospital, who frankly was perfectly well. They were dying well. They were actually enjoying life. But perhaps their breathing had become a bit shallow, and their wife panicked and dialed 999. So into Boston Hospital they went. And if they were lucky, they were discharged again 15 days later. Whereas actually what we then did was provide training in the house to the wife, so that she would know that if breathing became shallow, she should prop the patient up in bed. That was all. And that was enough to prevent that 999 call happening, and for the husband to say where he wanted to be. I'll just tell you one other little story, actually, because I told you we'd have fun. Which was, I went to see someone in their home in Lincolnshire, and they, by then, were having Marie Curie nurses. They were right at the end of their life. He was a very jolly man in his early 80s. And he was very jolly. He was dying extremely well with his wife. And I said, he said, I've got your Marie Curie nurses in looking after me. So I said what is always reported back to me by patients, which was, aren't they angels? And he said, well, I may be dying. I may be 82. I do like giving the wife a cuddle, and it's bloody difficult when there's a nurse sleeping in the room. But I learned a lot from that too. I mean, if you have a long-term condition and there's just a stream of different professionals coming into your house all the time with different sets of notes, asking you about your bloody illness or condition, rather than talking to you as a human being, you know, that awful phrase, how are you feeling today, dear? When actually what you want to know is, what did the nurse think about the fact that Swansea beat Chelsea, which is real life. And I think many of you in this room, or some of you, will know that your condition sometimes becomes bigger than your personality from the point of view of you. It's quite irritating, isn't it? So what we're going to do is very practical. What is the bad news of this commission, I think, is that Essex is being challenged in this commission to realise that the statutory authorities provide long-term everything that people want. Big distinction here. What the statutory services must provide is everything that people need. But I'm a great believer in people, particularly frail people and disabled people, having what they want as well. Isn't that how you achieve that? And there are some obvious answers. One of them is their local communities getting together to help. And that's okay in villages, it's okay in smallish towns. My God, it's difficult in bigger towns, and particularly in commuter towns. I think, too, we're going to have to wake some people up in Essex, which they're not going to like, and that's why the Independent Commission has a real value. But in fact, they're going to have to look after themselves sometimes, too. And that means preventing some of the things that will happen to them unless they take a greater responsibility for their own health. Now, it's no good government telling people not to smoke, because none of us like being told what to do by the Prime Minister. And I'm afraid that's why the big society doesn't go down very well. But if we can motivate people in Essex to think, like my wife motivated me to lose 1.5 stone over the last year, and to get rid of the car and walk to work, which I now do every day, and I feel much better, and I think, on balance, there's probably a better chance I won't get early-stage diabetes or heart problem. So I'm up for doing that, and I quite like it, and I feel better about it. And I think that that's why we're going to involve housing as well, because there's something around housing in all this, and maybe even really long-term around architecture. And we're going to look abroad, and we don't just have people from Essex working on this commission. I've also assembled a group of external experts who will help me look at some of the very best things that are going on in other countries and in other parts of Britain to address what is otherwise a very difficult problem. My final word is that I trained as a barrister. I wanted to be an opera singer, by the way, but my wife said my voice was awful, so that had to go. But so I trained as a barrister, and as a result, I'm passionate about evidence. So I am spending every Friday, roughly, between now and September in this country, going out to meet people and talking to them. And this is going to be very structured. It's not going to be sort of town hall meetings where people come and say what's wrong with the past. I'm not interested in the past. What I want to do is to engage with the people of Essex to share this problem that you face, because you do face it whether you like it or not, and say, what are we going to do about it? How can we change the way we act, manage our services and behave? And how can we stop services doing things to us that we don't want? Simple example. I will guarantee to you that in Essex there is a massive overprescription of antibiotics for children. I will absolutely guarantee to you. I've already talked to some GPs in Essex about this. And the answer given by the GPs is if he or she, GP, doesn't give in to the badgering mother of the sniffling 4-year-old, the mother will go to the next door GP and get them to prescribe the antibiotics. So it's almost sort of, just to give us some antibiotics, whereas the child doesn't need them and nature should take its course. And the cost to the state of those unnecessary antibiotics and the medical consequences of building up resistance to them is glaring evidence. It's probably not justified. Enough from me, I think.
Tom, thank you very much for that, and I'm sure you'll agree with me that we've absolutely found the right man to lead this commission. May not always be comfortable, but as you say, Tom, it will be fun, and I've no doubt that we'll end up with some really creative ideas as to how we can change things for the better as we go forward. I think we've, now you're going to have a round table discussion with colleagues there in a moment.
We don't want you.
No, I'm going to go.
Who will care is that at the end of 9 months we will have come up with 5 to 10 practical, implementable ideas which will maintain the excellent quality of care that is given in Essex, to do things in new ways, to help people provide their own care as well as relying on the statutory services to provide that care for them. Everybody will win. Will the eyes of the country and Westminster be upon us? I quite hope not, because I think it might be a distraction. But I hope that at the end, when they see what Essex has come up with in terms of good practical ideas about helping support particularly the care of the frail, the vulnerable, people with dementia in Essex, they may want to copy some of those good ideas.